So for those of you who don't know me, I'm Andrea from Women for Refugee Women. I'm the co-director here. I will hand over to our researchers in a minute, but I wanted to share a bit of context to our work. As many of you will know, Women for Refugee Women has been conducting research into the experiences of women seeking asylum for more than a decade. And that's as part of our role in the sector, to provide a gendered lens to some of the asylum policy debate that's unfolding. Our research has always been grounded in the first-hand experiences of women who are seeking safety. And over the years, we've increasingly tried to involve them in shaping and delivering some of that work. So everything from setting the scope and designing the research questions to contributing analysis and recommendations. But with this project in particular, we really wanted to go further. We wanted to ensure that women with experience of the asylum system had the opportunity to lead every stage of the research process from design to delivery. So with that in mind, we embarked on a peer-led research project, which is rooted in a participatory action research model. And this methodology really centers the involvement of those who are directly affected by the subject of the research, with the aim of generating both knowledge and social change. So in today's webinar, we're going to hear from our researchers directly about their experiences of this project, including their recommendations to others who are hoping to embark on a similar project following a similar methodology. So we've got about a half hour for presentations, and then we're going to be opening up the floor to any questions in the last 15 minutes. Please feel free to submit your questions throughout the conversation, and you can also upvote any particular questions that you would like answering. So we'll probably go to the questions with the most votes. I will now hand over to our researchers to introduce themselves.
Thank you, Andrea. My name is Anne-Marie. I wear 5 hats in relation to this project and my relationship with Women for Refugee Women. I have the lived experience of the policies our reports have explored. I am a network member of Women for Refugee Women. I am a researcher and an advocate, and I'm also a trustee at the board of Women for Refugee Women. I was honored to have been selected to take part in this research program. It has given me the power to educate, advocate, and build empathy to gain more understanding of the impact of harmful policies and push for change.
Hello, everyone. My name is Kathy, and I'm a mother of 2 children. I joined the research project because I am a woman and I have lived experience of 2 parts of the research project, which is living in the hotel accommodation and being banned from work. I really wanted to share my experiences in the asylum system, and I also hope for changes in some of the asylum policies.
Good afternoon, everyone. My name is Goldie. I was involved in the project because I wanted to be part of the voices for change to the manner in which women seeking asylum are being treated by the system in the United Kingdom. I was privileged to be part of the meeting with the Home Office officials to create more awareness about the experiences of women. Thank you.
Thank you, Goldie. My name is Tracy. I'm a lady with lived experience. That's why I got involved with Women for Refugee Women. From doing the research, I have more time to listen well, to understand, and to trust them, because I've been through thick and thin. I've been in those shoes myself. I feel proud of myself that I've been able to help those who can help themselves or speak for themselves. I've raised their concerns so they can be heard in government settings and all over, so things can change and be better for the women seeking asylum.
I'll now start by giving you some background and methodology to the research project. It all began in June 2023 when Women for Refugee Women launched a 10-week course, Introduction to Research and Research Methods. And with 14 women, refugee and asylum-seeking women from the network taking part. The course was designed to give participants a foundational understanding of research. Following completion of this course, 7 of us who had taken part were recruited as peer researchers for the new research project. The group comprised of women seeking asylum with diverse, intersecting identities, including women with disabilities, lesbian women, older women, and mothers. So this diversity really shaped the engagement, representing a broad range of the network members. The peer research team collaboratively designed the study, which investigated how the UK's asylum process restricts the liberty and freedom of women. They focused specifically on 3 areas: immigration detention, hotel accommodation, and the ban on work. The group of peer researchers led every stage of the research process, from designing the interview and survey questions, conducting the interviews, and analyzing data, up to writing up the findings. We also played an active role in advocacy efforts surrounding each report, and this included speaking at Parliament events, engaging with senior Home Office officials, and promoting the findings at conferences. The research resulted in 3 groundbreaking reports, which secured national media coverage and were cited in Parliament and contributed to policy changes. My colleague will post the links to all the 3 reports in the chat. This evaluation examines the peer-led participatory action research model, with particular focus on the extent to which peer researchers with lived experience of the UK's asylum system were meaningfully involved. It explores the challenges and opportunities in achieving genuine co-production and aims to draw out recommendations for those considering similar approaches. The evaluation did not involve an assessment of the quality of the research outputs or their impact in driving progressive change. This may be addressed in a future evaluation. I'll now hand over to my colleagues to talk a bit more about what factors supported the research project.
Thank you, Anne-Marie. One of the key factors that supported the project is the environment and infrastructure provided. An important part of the project that really made it a success was the environment we did the research in and the infrastructure that supported us. Firstly, our research took place in a university setting. We met weekly at Birkbeck University of London. We were meeting in a very conducive meeting place. We had access to the university library and Wi-Fi. The university setting gave us legitimacy, stability, and motivation. It also made us feel alive and human, getting up in the morning to go to the university to do the research. Secondly, we had the right materials we needed for sources. We had access to laptops, diaries, stationery, library cards, and printing facilities, which enhanced our performance. Providing materials for the research project removed economic and material barriers to our involvement. Many of us were still in the UK asylum system on limited support, so this was vital. Finally, we had access to numerous skills-based trainings. The comprehensive 3-month training we received, both in digital literacy and research skills, was the key foundation of the project. Many of us began the project with limited experience in digital skills and research methodology. Hence, we were supported with everything from basic IT skills, logging into the university systems, and managing files, to more advanced tasks such as conducting surveys, imputing and analyzing data, and understanding digital research practices. All of this builds our confidence, fostered independence, and ensure that all of us could contribute meaningfully to the research process.
Thank you, Kathy. Another key finding was feeling valued. One of the most important elements supporting the project was the sense of being truly valued as peer researchers. Every one of us was, recognized as a valued member of the research group, bringing a unique perspective and contribution. We shared responsibilities like making decisions and the execution of decisions made. Our opinions mattered. We were involved in shaping the work, designing the research questions, and conducting the interviews. We also co-designed the analysis and recommendation. That was a real sense of partnership. Our involvement was not limited to just the production of the report, and we took part in advocacy opportunities to promote the findings. We spoke at external events like in Parliament and met with the Home Office officials, as well as with partners and funders. These experiences boosted our confidence and reinforced the impact of our work. We also received financial support through a peer research educational grant, which was important to enable our participation. This grant was designed not only to cover essential costs such as travel to and fro from meetings, but also to recognize the value of our time, energy, and lived expertise. It explores the challenges and opportunities in achieving genuine co-production and aims to draw out recommendations for those considering similar approaches. The evaluation did not involve
Thank you, Goldie. A key factor in supporting the project was the emphasis we placed on emotional and well-being support. It was not easy for us as lived experience women listening to other women's stories, which could bring back painful memories, trauma, and anxiety. We were lucky to have access to psychological support through Trauma Treatment International, through TTI. We had reflective sessions which encouraged us to practice self-care and set up personal boundaries. We had practical support around how to handle difficult situations in the research process, like when someone tells you a story similar to your own previous experience. These sessions strengthened our emotional resilience and helped us manage to process stress and report with empathy. to the women we were interviewing. It made us brave faces in front for those who need our support. Our own lived experience also gave us inner strength to carry the project forward. We have all built up resilience throughout our lives, which meant we were able to manage difficult emotions. Sorry. We were also motivated by the belief that our work would make a real difference to other women going through the system.
We now look at the areas that held us back and our key recommendations to our partners, funders, who are looking to embark on a similar project. Firstly, it's so important to create a respectful, flexible, and positive team culture. Our lived experience brings diverse viewpoints and rich insights, and it's not always possible or necessary to achieve a full consensus. So it's important to have high levels of trust between people working together. We recommend encouraging mutual respect, co-developing a code of conduct as we did, and allowing autonomy in how and when we participate. So this fosters trust and inclusion within a safe, trauma-informed environment. Secondly, a participatory action research model should ensure a genuine co-production and shared decision-making power. Building authentic participation requires careful work, and participation means we shape the work rather than contributing to it. So we recommend involving peer researchers in all stages of the process, from design to dissemination, and encouraging shared ownership and collective decision-making to strengthen empowerment and impact.
Another factor we identified to have held us back is gaps in our skill set before we embarked on the research. Although we were offered valuable training sessions for research methodology and basic IT skills, we also identified areas where additional support would have strengthened our confidence and experience. For example, public speaking at events to take on advocacy opportunities was something we had to prepare for with the support of Women for Refugee Women staff. Training in communication and spokesperson skills before the commitment of the project could have helped us to better prepare for events. The need for more advanced IT and digital skills, such as typing, would have also been relevant not only for the research project, but for future development too. We therefore recommend providing comprehensive training in IT and digital skills and communication skills for future development. Secondly, offering a research training course before recruiting researchers, as we had, as this strengthened the quality and integrity of the research.
One of the issues we encountered during the course of the research was that we all had our own personal challenges that we had to navigate during the research process. In a volatile asylum system, we all encountered some very significant personal barriers that affected our abilities to fully participate in the project. We were either faced with physical illness like exhaustion, family issues, some mental health challenges due to past traumas we have experienced from the asylum system. The research was itself a constant reminder of the struggles and experiences some of us had, and the experiences of other women in the asylum system. We also faced practical challenges that come with being in a hostile asylum system where you are given little control over your own life. But we had to stay strong and positive. As a team, we carried each other, respected each other, and were there to support each other because of our strong commitment to the project and each other. It also meant that the research process was slower at times and that researchers sometimes had to dip in and out of the research depending on their personal circumstances. We recommend building flexibilities into funding applications, ensuring rest while on the project, and recognizing that people's ability to contribute can change over time. Therefore, a comfortable and slower approach that builds in time and space for the challenges that may present themselves is necessary for a participatory action research model. Thank you.
Thank you, Goldie. Embed trauma-informed emotional support from the start. A final recommendation we have in around the need of early access to emotional support and therapeutic space like those provided to us by Trauma Treatment International. While we did have this support in place, it should have come right at the start of the project before we embarked on the research. That would have helped us identify trauma-related needs sooner and put the place to address those needs at the outset. Many of us were drawing on deeply personal experience, and the early intervention could have helped us or reduce emotional fatigue. Some of us felt vulnerable to emotional distress, especially on sensitive topics. Support in early stage could have helped to equip us with tools to manage the toll of the research. Therefore, we recommend introducing structured therapeutic and reflective support from the outset of the project to proactively address emotional needs and prevent harm, especially for those who have lived experience.
Before we go to the question and answers session, we wanted each one of us to share a word that reflects our main takeaway from this project. And my word is co-production.
Mine is team spirits.
And mine is resilience.
Mine is bravely.
Wonderful. Thank you so much to our researchers. That concludes the presentation bit of today's webinar, but that leaves us a good amount of time, about 20 minutes, to look at questions and try to give some further answers and insights. We've got quite a lot of questions, which is great. I'm going to see what we can get through. The first question that we have is, what advice do you have for funders who want to support peer-led research? Which is a great question. We obviously couldn't have done it without funders. I wonder, Anne-Marie, would you like to take that one?
Wow, I was expecting this question and I'm so glad the funders are asking it. First of all, we think this is a great model and we encourage more funders to support similar projects. Why? It's because I believe this is organic, authentic information from and by the lived experience people themselves. So you never doubt, you never go wrong because you're now getting the real information from the people who are going through it. But at the end of it, it comes with the issues, and funders, please be ready for these issues because it's a slower process. Peer research moves at the pace of people's lives, and it's got to be really flexible. We have to allow longer project timelines because of the slow process. And researchers will be required to step back if they need because of their life experiences. There's really so much because most of us, when we started this project, were going through the hostile immigration system. And my colleagues mentioned some of the areas. One of us had 3 court hearings, proceedings during this process. We had issues like accommodation where you have to be moved or threatened to be moved in the process, but still all that, health issues, child care, family issues, reporting to the Home Office for these reporting sessions, the work ban, which meant we had limited financial support. All these were on our heads, but still, I'm so proud, and I'm speaking this from my strongest point, that we were committed and now we are delivering and we've carried this project up to the end. So I'm just so proud of the whole team and the support from the organization, of course, with the funding. So those funders who put in their effort, thank you so much. I hope more funders can get this and probably take more of this.
I'll come in really quickly because there were a couple of questions around what resource in terms of staff and general kind of financial resource Women for Refugee Women put into the project. And just building off Anne-Marie's point, you do need funders who are, willing to embrace a slower project, one that might take a bit more time. As she pointed out in the introduction, we started in June 2023 with the Introduction to Research Methods course. So really laying the kind of foundation for the research, then through to the planning, the delivery. We worked together on this evaluation. So it's been about 3 years in the making. We did have a policy and research manager who was mostly involved in sort of co-facilitating the sessions together with the researchers. And it was really a dedicated sort of full-time post. But other members of the organization were pulled in at various points as well. We had to involve, of course, our finance team, our fundraisers. We had teams supporting with any safeguarding issues that came up. We had some partnership work. So lots of different members of the organization were really involved in dipping in and out of the research. And it really became the kind of core focus of our campaigns work. So not insignificant, but entirely worth it, I would say, both in terms of the impact of the reports and everyone's involvement and how meaningful of an experience it was. I'd like to go to the next question, and I wonder if this one could be for Kathy, because you touched on it a bit in your introduction. The question is, how did you manage any disagreements or differences that came up amongst the team of researchers?
Thank you for that. Anyone would expect that in any group of people working on a project, there is always disagreements. We disagree to agree, to make decisions, and we didn't always agree on everything we discuss. And this is because we all come from different background, and we also have experiences that are different, especially while in the asylum process. And so in managing these differences, we created a code of conduct which we use as guidance whenever we are meeting. And this also help us in engaging with each other and also to commit each and every one of us to the project. However, with all the differences we all had, we try as much as possible to ensure that our decisions were guided by the data we collected and the views of the research participants. So everything is just a collaboration of each and every one of us. We disagree and we agree at the same time. At the end of it, we come together, we look at the decision, and we look at the data we collected, and that also shape us in arriving at a meaningful decision. Thank you.
Thank you so much for that, Kathy. There was a question that I thought perhaps Tracy could answer, and it was around ensuring the emotional safety and well-being of research participants. And linked to that, there was also another question about the extent to which researchers were involved at different levels, so as to ensure that no one felt coerced into kind of participating. So could I hand over to you, Tracy, to answer that one around emotional safety and well-being of participants?
Thank you for having me. As researchers, we felt well supported with our emotional well-being. We all took part in reflective sessions by the Trauma Treatment International, led by a specialist that helped us. There was optional one-to-one counseling for those who felt they needed it. We also had the autonomy to step back from the tasks that we didn't feel able to take part on, so no one was pushed. For example, we agreed that we would each conduct no more than one interview per week to reduce the risk of being traumatized by other women's stories. For the women who took part in research, we were careful to respond to their emotional cares. To ensure we were prepared for this, we did a few sessions in interview techniques. We practiced responding to difficult disclosures with empathy and learned when to pause in the interview. We were also trained to identify safeguarding issues which were flagged to Women for Refugee Women staff after interview. When necessary, they were able to get in touch with the woman we interviewed to offer further support. Thank you.
Thank you so much for that, Tracy. There was another question about, which we touched on briefly, but perhaps Goldie, you can add to that, around the role played by Women for Refugee Women staff in the support provided to the peer researchers.
Thank you very much, Andrea. The Women for Refugee Women, our group, we were guided by staff from Women for Refugee Women. They played an important role, in facilitating the project. They designed and facilitated each sessions and set a clear timeline for the whole project. And in addition to that, to logistics, they also tried to ensure our participation, was meaningful and found, ways to ensure everyone felt they could express their opinion. They made it easy for us to get involved. And as well, they were also involved in, safeguarding and ensuring our well-being as well. Regular one-to-one check-in with every one of us to, better understand our, response to individual circumstances. So they were there for us all throughout the project, which made a great difference to, us participating in the research. Thank you.
Brilliant. Thank you, Goldie. I have another interesting question, asked for a bit of an example, which I'm hoping, Anne-Marie, you could potentially answer. It's, could you give an example of something that workers did, or I guess staff, to help you feel the research was really co-produced rather than it being tokenistic?
This is an area I think where I'm very particular myself, because I think I've been in spaces where you just go there to sit and you recognize that you are present, but you're not given a chance to use your voice. But in all this program, as we started the real new project researching, we had Gemma like facilitating all the sessions, but in all, one thing, Gemma was listening to our contributions, and we had all the space and all the time and all encouraged to contribute to whatever everyone felt, and everyone was listened to. And as my colleagues mentioned about the decision making, it was at sometimes we didn't agree, but in the end, it was us agreeing on the differences, but not like Gemma coming up with ideas. No, Gemma always said, this is your research, and whatever you say, we all have to agree to it. So we felt that we really owned it. That is the best I can say. And I hope my colleagues have the same feeling as I have. Because for me, I've been to areas where, spaces where I only had to sign that, yes, not even being listened to. But we were listened to because this was our experiences, and we were in charge of the way we wanted it to be presented.
Brilliant. Thank you, Anne-Marie. We have about
I hope that answers.
I think that was an excellent answer. We have a bit more time. I wanted to briefly touch on one that seems to have come up a couple of times, and that was around the grants that we offered to the researchers. We called them the peer research educational grants. They were given to researchers on a monthly basis, and the idea is that they would support cover any costs that were related to them actually participating in the research. So that's travel to and from the office and to Birkbeck University, purchase of anything required, books, materials, etc. But it was also perhaps for the odd kind of treat. So we focused quite a lot on self-care and the idea of people being able to support themselves in a difficult moment. A number of the researchers were still in the asylum system, as someone had asked during the research process. So we were obviously very aware of the fact that receiving this grant could potentially have an impact on the support that they receive from the Home Office. So of course we have some caseworkers at Women for Refugee Women who were able to sit down with each of the researchers individually and look at their kind of individual circumstances. But I think, as this was one of the sort of big findings of the report, that grant was incredibly important. It was really there to value the kind of expertise that the women brought as lived experience researchers, and made them feel like they weren't just doing things as sort of unpaid volunteers, but were really being recognized for their contribution, for their time, and for everything they were bringing. Did anyone want to add anything else about the grant in particular, from either Goldie and Marie Tracy or Anne-Marie and Kathy? No worries if not.
Well, I think you've said most of the stuff, but I think I want to emphasize something to do with the travel, because I think one or two of us were traveling from outside London, and that is a bit more expensive. And I think the value, because we are adding value to the campaigning work of the organization. I think that meant real recognizing that value. And for me, that means a lot. It means a lot. So that is what I can say.
Brilliant. Thanks for that. I also saw that there were a couple of questions around how we recruited the researchers. So maybe I can start and then invite researchers to come in about their own experience. But as Anne-Marie mentioned at the start, we kicked off this project by launching a Introduction to Research Methods course, which was delivered to about 14 women who were part of the Women for Refugee Women network. And completing that course, successfully graduating from it, was really a prerequisite to then apply to be a researcher. The idea is that we wanted people to really understand what they were getting into, the project they were embarking on, and to come with those kind of foundational skills, rather than sort of coming in and not entirely knowing sort of what the project would entail. So from those group of 14 women, we then recruited. There was a kind of light touch interview process whereby people were asked about their motivation for taking part. We were, of course, looking for people who had lived experience of the asylum system. Most of the women were already members of the Women for Refugee Women network. So we knew them and we knew sort of their interest and engagement around campaigns already. And we did have a prerequisite that there would have to be a good command of English. We thought quite a lot about whether or not we could enable different types of translation, but we really thought that would be quite difficult. So in terms of the research group, everyone came in with a good level of English. In terms of the women who took part in the research as interviewees, they spoke all sorts of languages, and we did, of course, have translation for that. Anything anyone wanted to add on the experience of being recruited as a researcher?
I think what you mentioned about the good command of English was very important because, of course, as you may all understand, the organization has got a network of women who are at all levels, at different levels of English. But for a project like this one, of course, the English was like a first priority, really, to if you had a good command of English, because most of the staff was really basically required that. So that was good. But for me, I would like to add something to how we added or we managed to carry the interviews, because for the interviews, we're not looking at good command of English. We made sure that all women with all the different levels, if they were interested in giving us like their experiences, there were provisions to make sure that they are able to engage comfortably in the interviews, with the translations, with even a visual presentation, just to make sure that everyone was comfortably engaging. So that is where we felt that we tried to bring in each and every one who was willing and ready to engage comfortably.
Brilliant. Thank you. We have about 1 minute left, so I'm just going to do a wrap up. Firstly, by giving a huge thanks to our researchers for taking part in today's webinar and imparting some of their insights from this process. I hope everyone here found it helpful. I'm aware we didn't quite get to answer everyone's questions. Do feel free to reach out to myself or my colleague Corinza, who many of you will know, head of campaigns, with any further questions that we haven't quite answered. That said, the written evaluation of our participatory research action model will be launched tomorrow, but we'll be sharing it with everyone who's taken part in the webinar today. So you can have a read through that and do get in touch if you would like to discuss anything further. But thank you so much for taking time out of your day. We wish you all a great afternoon. Thank you.